There are various forms of heart disease around the world. The one that probably gets the least recognition and the least amount of time devoted to it are those in children with congenital heart defects. They've been felt to be inoperable, they're left alone, most of them just die of lack of attention. And this is a group of patients that's just been abandoned because of lack of available medical care.
Surgeons of Hope goes around the world building hospitals, which it hopes one day will be independent hospitals, and gives surgery to indigent children. They also have a component where they give surgeries to people who can pay so that the hospital can be independent in the end. When we first build the hospitals, it's very important that we stay on the scene and pay the bills and send our own doctors in to do the surgeries.
Just as important as trying to change the lives of the 10, 15, 20 kids we operated on, we were hoping to bring with us some skills that we could impart to the local physicians so that they could carry this sort of mission on when we're not there.
The Surgeons of Hope mantra, or their philosophy, is really the opposite of giving the man a fish. It's the teaching the man to fish.
But eventually, independence means that the hospital will run itself, have its own doctors and surgeons, and be able to be an independent institution. Our parent organization, Champ de l'Espoir, actually built the hospital in Cambodia, completely with monies given voluntarily by individuals.
The King of Cambodia and the Prime Minister were instrumental in helping us find a piece of land, as was the Minister of Health, and with the support of the Cambodian Medical Foundation, we were able to build the hospital.
Surgeons of Hope has an extremely important role, not only in supporting the transport and housing and so forth of the team to the local area, but also in coordinating the care. And they did an extremely fine job, I think, in orienting us to what we were going to find before we went there and making it possible for us to start surgery within the first 24 hours of getting there.
When we arrived there, we found a heart center that had about 50 beds. We found many more than 50 children waiting to have therapy. They seemed to know we were coming, and they sort of came from all over the country to this area to see if they could get some kind of care.
As a surgeon, though, I think the very important thing that one learns in these situations is, in some ways, innovation. And when you get to the Phnom Penh Heart Center, you are offered one of probably 15 instruments, and they're all clamps. And you just have to learn how to do your operation with that.
I think that the challenges are absolutely enormous. I mean, this is one center of 50 beds in a country with a large population.
We knew that there had been donated equipment that was relatively old, but still serviceable. The echo machine in Phnom Penh needed to have probes with higher frequency that allow one to discern smaller structures. Philips was kind enough to contribute these to the medical center, and so we were able to perform ultrasound studies on children of all sizes.
It's recorded on film, digital? A lot of the companies that I work with here in the United States donated free samples of both catheterization equipment, diagnostic catheters, and actually devices to close blood vessels and to close holes in the heart. We use that equipment that is not available to purchase there, and we left a lot of samples of that equipment afterwards so they could use it after we left as well. We take that off, put that over here. 10-8, please.
My role was to see as many patients as I could see and both evaluate them clinically and with the echocardiograph to determine whether patients needed surgery, who should go first, who should go second.
We would meet with their group of technicians and nurses and physicians, and we discuss the patients. We'd have a sort of a didactic session where we do some teaching, and then we'd go over specifically how we'd manage each patient.
Sure, we knew him. Those two on Thursday, so Pa, Patia, and they moved.
In addition to that, we went over the patients we had done the previous day and explained what we did and why we did it, and so the whole group could learn, not just the one physician I was working with, but the whole group could learn various techniques and ways to treat these patients.
Right over there. Very good. I think that it was impressive to see how quick many of these physicians were in picking up bits of information.
Where we would be starting to do the operation, and I'd look in, I'd realize the anatomy was pretty favorable, and the child was reasonably healthy to start out with. And so what we would do is we switch sides. He would become the primary surgeon, and I would become his assistant. And I would say, this is where I'd put the sutures, here, 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 here.
In this situation, we only had a week, and in the beginning of the week, I was doing the procedures and showing the physician I was working with how to do these procedures. By the end of the week, he was the primary operator doing the procedures, and it's extremely gratifying to me that we've left this kind of legacy behind, and you can continue to offer this care after we've gone.
First of all, I have always loved taking care of kids, and it is extremely touching to take care of kids who are in the condition that those kids are in, because most of them have deteriorated to a degree where they really are having difficulty moving from point A to point B. And the look of thanks on the face of the child, and that is quite honestly very, very touching.
First of all, we leave behind hope, because we have dealt with families who have a child who's very, very sick. In some cases, the child can't get out of bed. And after 2 or 3 days, that child is often running and playing with his or her friends. So a child who has used up the resources of his family is now able to help his family. In addition to that, of course, we leave behind the expertise of our top-notch surgeons. Every doctor in the hospital learns something from our surgeons. And we also leave behind equipment and technologies and a tremendous amount of goodwill.
We greatly appreciate the activities that the Surgeons of Hope have performed in Cambodia, and we hope that this will send a very convincing message, to all sympathetic donors to really have sympathy with the plight of children in Cambodia.
I think right now their surgical program and their abilities are probably at a level that would be where we were in the late 1970s. And I think that Surgeons of Hope deserves a tremendous amount of credit, because I think that just a couple of years ago they were about where we were in the 1940s.
If the resources are available, and with donations to the Surgeons of Hope, I think you'd be improving the care of children around the world.
Our most advanced hospital is in Cambodia. In 2006, we opened the Medical Institute for Children in Afghanistan. We have operations in Colombia, Mali, Mozambique, Senegal.
We're looking for an ideal country in which to put a hospital in the Western Hemisphere. That may be in Ecuador, possibly Guatemala, even possibly Haiti. But we want to have some sort of operation here in our own hemisphere, as well as in Africa and Asia.
For more information concerning how to donate to Surgeons of Hope, contact us at our New York office or visit our website, www.surgeonsofhope.org.